Hello everyone. Good afternoon to everyone. So I'd like to introduce myself, Dr. Shankar Srinivas Kuchibatla. I'm the Medical and Managing Director for OPENMINDS Psychiatry Counseling and Neuroscience Center. So today I'd like to discuss more about a common but a more terrifying condition called as post-traumatic stress disorder. As you know, post-traumatic stress disorder is something that it's commonly seen in the clinical practice, but it's a very challenging and complex condition to treat. So today we have Mrs. Huda Khreishi. She's a CDA licensed psychologist with an extensive experience in the field of trauma, especially post-traumatic stress disorder. I would like to introduce Dr. Huda, and it's our privilege for the Open Minds to be in the presence of Dr. Huda. I'm sure in the collaboration with Mrs. Huda will be a great benefit to the clients who are going through this condition. Welcome, Dr. Huda.
Thank you, Dr.
So
Shankar.
much to be part of our team here at Open Minds.
My pleasure.
Yes. You have a huge experience and interest in the field of PTSD. So you have done a lot of certifications and gained a lot of experience in California University. I'd like to introduce to our viewers about your experience, and also can you just kindly take us through what exactly the experience behind PTSD you have?
Well, it happened that I dealt with many clients who had experienced traumatic events, like people coming from war-torn area, or all other types of traumas, and that specifically encouraged me to get more knowledge and training in that field, because, as you have mentioned, Doctor, it is really one of the most difficult disorders that we have to deal with. Luckily, recently in the field we have new and very efficient psychotherapy or modality of dealing with PTSD. For example, what we call EMDR, eye movement desensitization reprocessing. And we also have, under the umbrella of somatic therapy, EMDR falls under that umbrella, as well as another therapy called somatic experiencing. Both are so efficient in relieving the stress and the distress that PTSD is causing.
Thank you so much, Huda. I think I'm sure this is a novel therapy. I know it's been there for many years, right?
20 to 30.
20 to 30
That's
years,
considered.
I heard that, and I think there is very few specialists or psychologists who have got this experience behind. I think it's our privilege that for your presence at Open Minds. I'd like to know more about your career and qualifications. Can you please tell to our viewers, from where you graduated and so on and so forth?
I graduated from Cal State University of Fullerton. It's a public, well-known, and the Department of Counseling, or this major, let's say, is one of the most prestigious nationwide on the United States. I also had years of experience in the same area, Orange County of California, where I dealt with multicultural population and different ages and different variety of mental and emotional issues.
Excellent, coming to the PTSD condition, in my clinical practice as a consultant psychiatrist, I see clients going through various traumas, maybe the recent one or something which has gone in the past, like maybe in the childhood or a teenager, in various modalities. Could be PTSD, as you know, it's not something related to the road traffic accidents. It is related to traumas in day-to-day life, actually, from various family members, so on and so forth. So, in your experience, at what level the client can be referred to EMDR therapy? Is there any particular criteria to be fulfilled for that?
Actually, I would like to answer, I would like to start with explaining our new understanding of trauma. Yeah. Actually, trauma is not only what we used to know, that terrifying, life-threatening events like war, accidents, or even witnessing something like that. Now, the understanding of trauma has been expanded to become any event that is overwhelming to our nervous system. It can be something like being embarrassed in front of someone, like being insulted, not having the needs as a child out of love, or even emotional acknowledgement and validation.
That's how I think the social anxiety and social phobia also develops.
So our understanding that different symptoms, things like depression, even eating disorders, anxiety, things that are not diagnosed as PTSD might be the result of a trauma that was stuck somewhere, of different types, the way that I explained just now. So the answer of that, EMDR can be useful and has been proved to be efficient for different types of mental issues and disorders.
I think in the pathway of the treatments for the post-traumatic stress disorder, of course, medication management has also been, I think, used in severe cases. That goes in parallel with the therapy, psychotherapy. I have heard about trauma-focused therapy also, the cognitive behavior therapy. Can you just tell me what is the main differences between this and the EMDR, and what is the latest evidence talking about in regards to this comparison between both the therapies?
I would say, according to my knowledge and the research that I've been looking at, both are good enough, as long as it is trauma-based. The point is being informed enough and have in the back of the mind of the therapist that trauma is feeding the symptoms that the client is suffering from. Up to my knowledge, both are good enough, both are efficient, but yet we have to consider what fits the client. Some clients would feel this is more appealing, or like, they would accept it. Usually we advise therapists to have a group of tools to deal with the client according to their nature or what they accept to have as a modality.
Should be more of a client-centered and as per their
preference.
Yes. That's great to know. Again, some of the symptoms what I see in extreme cases of PTSD, like regular flashbacks, nightmares, they avoid the situation. Sometimes they relive in the same situation, and they have physical symptoms. You name it, related to anxiety, and also the social isolation and depressive symptoms that comes later on. Are there any specific symptom categories that are being targeted in EMDR, or what you do, what you practice in your clinical practice?
All devastating symptoms, as I mentioned before, anything that is influencing their day-to-day life, their relationships, can be a manifestation of some trauma that happened recently or in the past. So again, all the symptoms that is causing distress for the client, for the person, regardless what what diagnosis or what we call it. Is it depression, anxiety, OCD, eating disorders? All usually it has a past, there is somewhere in the past or even in the present some devastating or traumatizing event that happened that triggers these symptoms. So we deal with all. Yeah.
Are there any particular number of sessions that the client should be have commitment for EMDR especially?
Well, actually, EMDR is considered as a short-term therapy kind, which what we mean with short-term therapy, it's between 8 to 12 sessions in average. Yet, it depends on the case, on the preparation, how much the client is ready to have this kind of processing for the trauma. So it depends. It depends on the case, and what we do usually is for the first stage is to make sure that the clients are stable enough and they can regulate the emotions that can be surfaced while we are doing our job.
Mm-hmm. And some of the clients, they are already taking the medications, could be anxiety related or depression related or anything.
Mm-hmm.
Are there any contraindications for the use of medications while doing this therapy?
Not as much as I know. Yeah. It's actually might be a helping agent to stabilize patients or clients and to be ready for the processing stages of EMDR.
Thank you. Mm-hmm. And Mr. Huda, I know you originally hailed from Jordan, and you moved to United States of America later on. Mm-hmm. Can you please tell us, our viewers, what are your language preferences and on which language you do the therapy for the clients?
Both English and Arabic.
Yeah. So even the EMDR part or the CBT part can be.
Yeah, both languages. Yeah.
And finally, apart from EMDR, I want my viewers to know about what are the other conditions you usually prefer to take, from the client's population.
I'm also a marriage and family therapist, and maybe we didn't talk about the kind of training. It's another wonderful modality in the world of couples therapy. It's called EFT, emotionally focused therapy. It's an attachment-based therapy where it's also recent. It can be described as new type of therapy. It's been like 30 years old in the market, and it's also evidence-based. Much research proved how effective it is in the couples therapy. I'm so excited dealing with couples using this wonderful and powerful tool and see the change in their lives. It's really amazing. Yeah.
I'm sure. I think it's going to be a huge expertise actually at OPENMINDS with your presence, dealing with both trauma and also marital and couple therapy side of things. So finally, thank you so much, Mr. Huda, for your presence at OPENMINDS. And again, I'd like to welcome you on behalf of entire team at OPENMINDS.
So excited to be here.
I'm sure with the collaboration of the Department of Psychiatry and Psychology, with your expertise, our clients will be able to really get benefit from it.
Yeah, I'm so sure of that.
Thank you so much, viewers, for your attention and presence. Please stay tuned. We'll have another exciting session with our team members.
Yeah.
Thank you so much.
Thank you.
Good afternoon.